Well, you know, summer's here. We all want to look and feel our best, don't we?
Yes, and Dr. Eric Kusher is here from Compass Fat Loss to talk about a pretty unique program if you're trying to lose fat and it's really just been stubborn. Welcome.
Hey, how are you guys?
We're excellent. How are you?
Never better.
You look
good to see you. I try my best.
Yeah, you're looking good. Your hair looks good. Did you get a cut or something?
You say that to all the boys.
So, you know, a lot of us, especially reach that midlife and you're just like, what's going on? What worked for me in my 20s isn't working anymore. And you are encouraging people when they come. What's unique, one of the unique things about your program is you actually test in the lab so you can see when their metabolism isn't working, right?
Yeah, let me kind of set the stage if I might. You know, if you turn your TV on today, you'll see commercial after commercial for slow metabolism and insulin resistance and all this stuff. And they're right, but the question I have is why? Why is your metabolism slow? Why do you have insulin resistance? And you don't know that until you dig down and do some specific testing.
Okay.
So we have a battery of 6 lab tests that we do in one shot. It's one visit to the lab. And each of those readings that we get gives us information on exactly what's going on in your metabolism that's causing weight loss to be difficult.
Okay, so it's a simple blood test.
Simple blood test, but you can't go to take a pill or a metabolic shake booster and expect it to work because you don't know underlying what's going on.
Okay.
So let's talk about what you're testing, because people are going to go, well, it's not calories in, calories out, right? That's
way more
old thinking, right?
Exactly,
so,
you're right.
Number one, you want to know like your fasting insulin and your fasting glucose. And here's the other things: uric acid, copeptin, AST, lipid profile. That's going to look like Greek to a lot of people. Can we talk about them one at a time? Like, why do you care about your fasting glucose and fasting insulin?
Yeah, sure it is. Let's talk about both of those together. So if you do a fasting glucose, you'll see what your blood sugar is at that moment, a spot level. But you don't know what it's doing throughout your life. If you do a fasting insulin also at the same time, we do a calculation that spits out a number, and it puts you on a scale of 1 and above on something called the HOMA insulin resistance scale. And if it comes back low, you know you're insulin sensitive, which is a good thing. Easy time burning fat, hard time storing fat. If you come out a little bit higher, you're leaning towards insulin resistance, and these patients have a harder time burning fat and an easier time storing. So we need to get them knocked down, but we don't know this until we get those couple of readings.
Okay.
And this is not something that you get in your regular physical?
Generally not.
Yeah, no, I don't get it. I've never gotten any.
Well, you get your they usually do your glucose.
Right.
I don't even know
You'll
what the levels are.
You'll get limited numbers, but you won't get this full battery of tests.
Because basically a doctor's trying to make sure you're not diabetic, but this is like, okay, what's going on? And the next thing, uric acid?
Uric acid is super important. This is probably at the top of the list. Uric acid used to be looked at by your doctor just to see if you have gout or maybe a certain kind of kidney stones. Uric acid in much more current research has shown to be a metabolite that dictates how your metabolism is really working. And things that you can do about it to lower uric acid, make your metabolism much more efficient, and make the weight loss process much more efficient as well.
Copeptin.
Copeptin it's a precursor of a hormone called vasopressin. And when copeptin is off, vasopressin is off, it can cause you to retain fluid. It can cause you to suffer from high blood pressure if it gets out of hand.
Okay.
We need to see where this is to make sure that that stays in normal limits too.
And AST and ALT?
Okay, these are 2 enzymes that you'll see in a liver function test. And these are really important because they will show you your risk factors for something called non-alcoholic fatty liver disease. You don't hear much about that, but it's as damaging as cirrhosis.
Wow.
It really is. And unfortunately, about 50% of the population has it to some degree.
Yeah.
So if we see ALT and or AST elevated higher than we want it, we know we're heading in the wrong direction and we can do things to correct it.
We only have about a minute, but
So we've got your lipid profile and then the CRP, which I do know a lot of functional meds and naturopath doctors test for that. That's your inflammation.
Exactly. It's a general marker for inflammatory status. Yes.
So once you have that picture, then you design a plan specifically for them. I mean, you can correct this stuff?
Absolutely. And it's all dietary, supplementation, exercise, lifestyle mediated, no drugs.
A lot of exercise, or you?
No, just the right kind.
Just the right kind.
Yeah, a lot of these patients will need maybe more strength training, a little less cardio, so we'll fine tune it for each patient.
And the program is 100% virtual.
It is.
So there's no excuses like, oh, I can't make it to the office today.
We don't accept excuses.
No excuses.
But you do face-to-face. It just means you're going to do it, you know, on your FaceTime or on your Zoom. It's not
like a Zoom,
it's not like you're just getting emails and figuring it out yourself. You are really guiding every moment.
Personal contact all the way throughout, yes.
But you can, if you're a busy parent or you're busy at work, you can take a minute and go into your car and have your doctor's appointment.
Sure, our patients love it.
Okay. Well, thank you so much.
My pleasure.
That was excellent. For more information, visit compassfatloss.com or call 800-735 2281.